Are the Moderna and Pfizer-BioNTech COVID-19 vaccines gene therapy that alters recipients' immune systems, a potential Nuremberg Code violation for doctors and nurses to administer them without telling patients they are part of a drug trial, and are they killing or seriously injuring thousands of vaccine recipients? No, these claims are either untrue, made without evidence, or leave out context. mRNA vaccination is not gene-altering therapy. The immune system alterations claim is missing context. The claim that the vaccinations are experimental is false, as is the Nuremberg Code claim. The claim that thousands have been harmed or killed is not supported by available evidence, and Ms. states what's in the government database of informal reports of patient observations post-vaccination. The claims appeared in a video published on Brand New Tube on February 2, 2021 titled "Doctors and Nurses Giving the COVID-19 Vaccine Will Be Tried as War Criminals," which included, quote, "Incidentally, I'm well aware by the way that a decent part of the medical and scientific community doesn't believe that the stuff currently being promoted like a new brand of crisps isn't a vaccine at all. For the record, I agree with them. It's a form of gene therapy." End quote. Users on social media only saw this title, description and thumbnail, quote, "Doctors and nurses giving the COVID-19 vaccine will be tried as war criminals." In recent months, Dr. Coleman's videos have been targeted by trolls spreading lies, libels and misinformation, and because of this, Dr. Coleman has had to disable comments. "We hope you understand," in an emotional video. End quote. Source: Brand New Tube screenshot taken Saturday, February 13, 1914 2020 UTC. The FDA defines gene therapy as modification of a person's genes to treat or cure disease, which is not what messenger RNA vaccination does. A professor of medicine at UCLA told Lead Stories that there is no evidence the vaccines will permanently alter patients' immune systems in a negative way. He also explained that since Moderna and Pfizer-BioNTech vaccines have both been given emergency use authorization (EUA) by the FDA, vaccination is no longer experimental. The Nuremberg Code, enacted in response to Nazi experimentation on genocide victims, governs human experimentation, not pandemic vaccination campaigns. Throughout the 15-minute video, Dr. Vernon Coleman makes a series of claims related to what he simply describes as the COVID-19 vaccine. It appears he is referring to the Moderna and Pfizer-BioNTech vaccines, since they are two mRNA shots. The video is one of several posted on brandnewtube.com that feature Dr. Coleman, a one-time general practitioner who relinquished his medical license, discussing the COVID-19 vaccine. According to his website, he has written over 100 books, including "Anyone Who Tells You Vaccines Are Safe and Effective Is Lying," and worked in hospitals and as a general practitioner, but resigned from the health service on a matter of principle. Here is what Lead Stories found regarding each claim: false, it's a form of gene therapy. At 2:30 in the video, he states, quote, "Incidentally, I'm well aware by the way that a decent part of the medical and scientific community doesn't believe that the stuff currently being promoted like a new brand of crisps isn't a vaccine at all. For the record, I agree with them. It's a form of gene therapy." End quote. The chief of infectious diseases at Oklahoma University Health Sciences Center confirmed to Lead Stories what the FDA says on its website: by definition, mRNA shots are not gene therapy. In a related debunk, Dr. Douglas Drevitz, chief of infectious diseases at Oklahoma University Health Sciences Center, said in a February 3, 2021, email to Lead Stories that the mRNA shots are not gene therapy don't revise human genetic codes, quote, "Vaccination, e.g. mRNA vaccination, does not alter any genes, DNA. It simply instructs our immune cells to make an immune response against a germ, or against a part or a product of a germ, e.g. a toxin, such as in tetanus or diphtheria." End quote. No evidence cited. There are very real risks of changes to the immune system of those having the vaccine. At 4:26 in the video, Dr. Coleman says, there are very real risks of changes to the immune system of those having the vaccine. According to the CDC website, a COVID-19 vaccination does impact an individual's immune system. It teaches your immune system how to recognize and fight the virus that causes COVID-19, and this protects you from getting sick with COVID-19. Dr. Yang explained that there is no reason to believe the vaccine will damage or permanently alter the immune system in a negative way. He explained, quote, "The vaccine is exposing the body to a foreign protein from the virus, by having some cells make that protein.